Minnie, welcome to Stories in AI. How are you today?
Very well, Ganesh. In gratitude, and always a pleasure to talk to you.
Always a pleasure to talk to you too. Thank you so much. We've been trying to plan this for a while, and finally we got the stars aligned to go make this happen. Why don't you kick us off with your story, your background, and who is Minnie Suri, and how did you come about to being who you are right now?
Great. Ganesh, I grew up in India, a town outside New Delhi, Faridabad, two sisters, very well passionate parents who really wanted us to be successful academically. So studied, I went to Chennai to do my undergrad and then came to US to do my master's. When they say there are two great men behind you, I always say it's my dad and my husband, because without them, I couldn't have done what I am here. Did my master's, and I actually joined financial services. I was leading very niche technology in Citigroup, and I call that as my academia because obviously the scale, the products that I actually was able to learn and grasp and implement was amazing. And I must say that I got very amazing opportunities of really leading AI or making Citi a conversational AI bank by board of Citi, and build a lot of automation in that space, and then eventually moved to Uber as the head of AI and automation head, and then also went into really AI product company. However, all this actually helped me prepare into what I am today as a CEO of a health tech AI company, Velmeni, which is basically we are pioneering in AI in dental first, and then eventually larger healthcare system. Healthcare was always my passion. However, I did not know my path. I crossed the industry, but I think it's all for good, and that makes me feel very accomplished, very privileged that I could do that. And I must say, one reason I must say is because of MIT, which is my alma mater, which really gave me the wings to really have the courage to actually fulfill my dreams.
I'm on mute, of course. Like it's the Zoom disease, right? Everybody gets it. So I
Yes.
was going to say, like what a fascinating background. And there's one another intersection point that I just thought of was like you grew up in Faridabad. I have five engineers now in my company, Autonomize, who are actually based out of Faridabad right now. So excuse me, I'm going to probably make a trip to go out there and visit them in November. So that's an amazing connection. Okay.
Great, great.
This is awesome. So tell me a little bit about Velmini, right? I mean, what are you solving for today and what's the vision?
Yeah. So let me tell you why Velmini. Velmini actually is an Icelandic term for robot. So people think it's on my name. Actually, the name was decided 8 years before I became the CEO of the
Yeah.
company. We truly want to be a pioneer in AI, which means any facet of AI. We started with dentistry first. However, dental space is really ripe for innovation and disruption. There are a lot of use cases that I see coming from an outsider that can really help enable better patient care. So dental area allows us, from the AI perspective, to have better early intervention, have AI tools that the dentists usually tend to miss. It's not that the dentists are not doing their job right. It's just that human eyes cannot comprehend every diagnosis, every use cases. By end of the day, the eyes do get tired. However, AI can detect at any given time 24 by 7, and we can have a very consistent reporting out.
Yeah.
So Velmini is something that came into being during COVID time, or I would say post COVID time, and the need was very valid because the dentists really could not take care of the patient. And that's where AI has become even more important and necessary, because humans or dentists cannot be everywhere.
No, it's pretty awesome. I want to dive a lot more deeper into that thing on the specifics and stuff too. But you're bringing up a good point, right? I think the timing for AI in healthcare is now. I mean, I fundamentally believe I have a lot of experience working with IBM Watson guys back in the day. Had to clean up a lot of the mess they made at some of the companies that I work with customers. Like, and I think it was just bad timing in my view, right? Because I think today there's a lot of the tailwinds of things like better connectivity, better access to things, more comfort with digital channels, telehealth, and telemedicine. You're just now in a point to actually go explore a lot more and drive a lot more impact right now, right? So tell me a little bit about why AI in healthcare. Talk to me the reason. What does the potential? What's the promise here if we solve it?
Yeah. Right. And I think the promise, as you said, is immense. I mean, we are talking about healthcare in privileged sector. We haven't even thought about, remote areas where the resource settings are very poor, or
Mm.
it's not even there. Um, I mean, the potential to outreach using AI is a lot faster than having to train someone in the space, in this dentistry or in healthcare, which takes years and years, right?
Yeah.
Think of it in COVID. How did our dental students or healthcare students were impacted? They could not have their hands-on experience, right? So the thing is, if you actually compare a dentist, it takes anywhere between 5 to 10 years before they really can become an expert in reading these X-rays. Whereas if you built an AI model, right, it can scale so fast. We are not saying the AI models are perfect on day one, but they train, and once they get the training and they are fed on these data set, eventually they do perform, and they're able to find. And again, by the way, they're not replacing anybody, but they actually aid a dentist or a health provider in a more
Yeah.
comfortable way. In a way, we call it a second dentist or a second expert
Augmented.
sitting next to
It's
them.
the
Exactly.
Jarvis suit for the
It's a
dentist, right? So
Absolutely, absolutely. And by the way, the technology has enabled it. I would say even 7, 8 years back, market wasn't ready, people were not ready, but now they are. From both, I would say, consumer side, both from the provider side, as well as the technology like 5G coming into picture. We have more compute powers. Our, mobility is much better. All those things definitely have added a lot into really reaching out with what AI promises to bring. So I think this is a great time. There are so many use cases that we can see with AI. It's not just diagnostic on deep computer vision, NLP. There are like different facets that we can see, if we combine together, actually bring a great use case.
no, look. It so happens that I also lead a healthcare AI tech company, right? So Autonomize, and we haven't really talked about what we do in public, because just kind of in semi stealth in the process of coming out. But one of the things that the theories I have, and I want to test this with you as well, is that I think, look, health and data are two um, very noble things. So if you think about like data becoming, or is already, is there's enough evidence that the most valuable asset in the world is data, right? I mean, not just how organizations make money off it, but if we really look at how much market cap Facebook or Google has generated by using human data, right? I mean, just human generated data sets. It's a very good evidence on the one hand. And we now have the technologies, the methods, the process, and the research to go harmonize and get maximize the insights and knowledge residual in the data. On the other hand, improving the human condition post COVID, at least everybody got a really good wake up call. People who have never, lived through plagues and world wars, and everybody, it was very evident that one of the most noblest pursuits is to go improve the human health condition, right? And then for us, for me personally, it's about bringing the two together. Like, how do you actually guys get the engineerable problem of gleaning insights from the data and apply it to improving the human condition? And but what you said actually, reminded me of two things. One is the how should AI help, and the opportunities now, which is very evident, a lot more data than it was and stuff. But there's a lot of challenges because most of the data in healthcare is human generated data, right? It's about the humans or other things, but including research, doctors' notes, x rays, imaging data. It's human generated, aka not easily computable or analyzable at scale, right? That's on the one problem. The other thing is about this whole notion of I think there was all this concerns, and this I can relate back to my friends at IBM Watson. Like, they are to blame when they actually said Dr. Watson is going to be the next biggest oncologist. The reality of the matter is healthcare and is actually care primarily, so it has to have a human in the loop, at least for a foreseeable future, right? And nobody's going to complain about, because we have a shortage of healthcare professionals, not a surplus. So nobody's going to get replaced. If anything, they were going to get augmented on this thing. It's interesting. So talk to me about AI in healthcare in terms of where is the state of the market today, right? Is AI being deployed in all these places? I know you have the dentistry point of view, and I have some opinions on that too. But broadly, give me some broad strokes on how do you see the healthcare market, especially in automation and AI.
Yeah. Yeah, that's a very, very good point. Though we are seeing AI is making inroad, in some cases it's still a buzzword, right? People don't understand. First of all, they're afraid. They feel that as AI is here, probably will take my job. People don't have a better understanding, and that's why I feel that AI education is very, very important, and that's why the product that we came out, Second Dentist, is about that. How do we educate our
Yeah.
dentists about
Do
AI?
you think, is this still a concern that people think that AI will take their jobs away, especially when they have no time to breathe? They still
Yes,
believe that?
exactly. They are. They do. And there is a fear. I've seen that. There is a fear, there is a stigma. And I've seen that is more in older providers than the younger generation who's coming out, because they are savvy and they're willing to test and try and take risks. It's also risk taking, a little bit of risk taking. And they know because they've grown up with technology. So I also see the adoption coming quickly from some of the younger healthcare providers than somebody who's really set in their ways because they're almost about to exit their career and they don't want to change their, what the way they have been working all along, because it's very hard for them. So, so I see this as a transitional state. The eventually this wave is going to ride. AI will become a part of the way the work is done. There is no giving. I mean, we've seen COVID was such, I would say it was an accelerator. Actually, it took us 5 years ahead of what we were thinking.
Yeah.
I would say, I think what it has really accomplished is that, yes, you need automation. You cannot have humans deployed everywhere. You cannot have human on grounds or troops on grounds, I would say, everywhere. Think of it. I mean, I'll tell you, Ganesh, a very interesting story. I mean, healthcare, as I said, was very important. While at MIT, my dad was diagnosed with brain tumor, and
Wow.
the reason the tumor got missed was it was a very tiny speck and obviously got missed. Uh, 4 months later, it was stage 4.
Wow.
Early intervention, if it was detected, let's say by a sophisticated AI scan, I'm sure we would have detected, right? Um, that hit me very hard. I still remember. I did not know my path. I wanted to do something in healthcare. I started taking health tech certification while I was there. I actually switched all my projects to healthcare. I started working my I would say end of MBA project was working on uh, electronic health record for rural India. I really wanted to see what that healthcare, how the healthcare can change, starting, going into remote areas. India was one of the countries that we chose, but it is anywhere and everywhere. So my path wasn't clear, but I knew I had to do something. And when I saw the I would say the stats, it was one doctor to 20,000 villages or villagers. It was insane.
Wow.
There were a lot of non-for-profit were doing some phenomenal job, and I actually happened to meet a lot of people, who were in that space, but we knew we could not scale. At that point, I remember AI was still something which we were all toying, but we did not know. But now, post COVID, with where we are with telehealth, teledentistry, I think we can make a significant impact. And I can see it, I can foresee it. It's not that far. We just have to have proper training, both on I would say we also have to educate our common, like people as well, where AI can be a substitute for a doctor or a dentist. At the same time, we can have one of the best cares be provided in matter of seconds. I mean, they don't have to travel, whereas the best treatment can be given, or at least be at least they can be guided how they need to take the next step and not live with that pain or the problem and let it fester. So again, to your point, I think the this is the time. We need to lay the seeds now.
No, what a touching story. And I think, it's important to understand that while the privileged side of the world actually thinks about saying AI is going to replace my job, and I mean, quite candidly, right, the fact that, oh, if I do this, I'm not going to be able to retire comfortably, and I can bill only a little less of hours and stuff. There's the whole other side of the world who don't have access to care, right? And AI, for me, it was always about scaling human cognition or human expertise to so find the best dentist in the world, clone them as an intelligent agent to do most of what they do, and then deploy it at the remote edge, which don't have the luxury of actually having that gentleman or gentlewoman to support them in their care needs, right? So it's a fascinating thing, and I love the story how, and I like, like talking about dentistry and a dentist, right? I grew up in India, southern India, right? I got to tell you, maybe I went to a dentist um, when I was like 7, 8 years old. And then the next time I went to a dentist was I was working in Bangalore, and I was 28 years old, and they had a free dental checkup. So I showed up, and they're like, really? I mean, like, my teeth thankfully hasn't deteriorated too much, but we never go to a dentist. And,
Right.
to your point, I think you and I were talking earlier, dental health is not just about the teeth, right? Back to the early indicators. If you have heart disease, it's going to show up. If you have, degenerative diseases, it might show up. I mean, there are so many different ways. If you have
Diabetes.
diabetes,
Yes.
right?
Yeah.
So I think
Mhm.
I love the fact that you guys are starting in dentistry, because I believe that definitely an underserved sector in general, and it's a huge global problem. So one question I have, as we come through that thing, saying, like, we've established that the time to do AI in healthcare is now. We've established that the opportunity is about scaling expertise and bringing the best to everyone, driving access, and so forth, right? What about the flip side of this, right? How does this put data, privacy, patient ownership of their data, and stuff like that? How does that landscape play out right now?
Yeah, it's an excellent point, because data privacy, it's the data that we are all. I think we all have the owners, right, who are in the software business building these healthcare applications, platforms. I would say, uh, I just go back a few years with my days at Citi, being in financial services. For us, data likewise, data is very, very crucial and very important. And I think the whole, uh, I would say, the whole risk of keeping the data secured is sort of like ingrained. I always used to say it's in my DNA. And I see not different coming into healthcare industry now, because with HIPAA and other regulations, um, data, not just because data can be monetized, it can be used with various purposes and so on, but I think it's human data. and we all hold responsible for keeping data as secured as possible, where we use the data for our building our models, doing our research, getting the better software out that can make a difference. However, I think it is something that we, all of us, collectively, I would say, and can keep our data secured. Now, that could not have been possible. It was difficult, I would say, how we kept the security when we were using on-prem, because I still remember the days when we could not, or we would be afraid to even go on cloud because the data leaks. Was the data secured on cloud versus on-prem data centers, and keeping as close as possible who would have access to data. And I think we are now on cloud, we have encryptions at rest and encryptions in flight, and we make sure that who has the access to the data, the right people. We basically have put all the risk and controls, which are so important. I think and again, there is an advancement in technology in every which way that we are talking about, right? And the thing is, why I say this is the right time for us as well, because we have massive data. We are talking now in terabytes, petabytes, even more, right? When we at times think about the data that we get over time, I would say that we can only scale, we can only get better if we have the right technology, right protection plan, right risk management policies, and that is also very important. Keeping this data in sort of like in the right form and shape. So I would agree with you on this aspect, because I think for me, when I'm building this platform, HIPAA data privacy is equally important.
Yeah, no, it's in fact, I think, we talked about how data is more valuable and stuff too. Like the value realization of that happened only to a group of data hungry social media companies in the first iteration. So I'm pretty sure that I'm hoping that we change that equation in this whole notion too, right? Patient data is important. And the other thing that, I've always been fascinated with is like, I believe healthcare is sick care today. It's not healthcare, right? It's all about interventions and triaging problems, and something is, but it is not really evolved into treatment to preventative medicine, right? Or personalized medicine. Like, it's still, the pharmaceutical industry is extremely industrialized in the way, today. It's not everybody's trying. Now that we have the data, we have the tools to go make it happen, we're doing it. So, I mean, in the midst of all this, I think we want to get this right in terms of privacy and data ownership as well, right? I mean, a lot of strides have happened, primarily from regulatory side, and people, the tech industry is notorious in general for not doing things unless they're forced to, right? And that's changing slowly. So it's not just the regulatory framework, it's about truly thinking through what does it really mean to be a patient centric company in healthcare, or a human centered company in healthcare, right? So things like that. So fascinating. what's your um, what's your advice for healthcare innovators, both in large companies as well as early stage companies, if you will, and how they should capture this big opportunity? What should they be focused on? What's some words of advice building a company and a business powered with AI?
Yeah, no, I think that's a great point. What I believe, we can make difference when we walk together, because it's a huge problem. We are all trying to solve a piece of the puzzle, piece of the problem, and I don't think so. We can work, or we can solve, if we work in silos. What I believe is obviously playing together, integrating our products together to build better solution. I've always built in that. uh, no one company can build all, but they can integrate all, and they can build better, innovative solutions which can have better patient outcome. I think the idea, the focus that we have is better patient outcome, as I say. And that's where I believe, and my vision is to pioneer, to really come up with those solutions that we can build together that can really have an impact, not just on the patient, but also with the providers. Because if we make our
Yeah.
providers more enabled, I think they would be able to serve more patients. They will be able to outreach more patients, not just in the geographical region or area, but obviously much more than that. We can actually take the knowledge that we have seen with our healthcare providers to the areas there where we could not even think of a few years back. So I think AI is, as I said, is an enabler for our healthcare providers. It's an enabler for us, like you and me, and other folks in this industry, to be really think from that perspective. How do we build? How do we integrate? How do we build this whole community of AI enthusiasts, right? And think from solving a problem for a greater good. And I think that's, to be honest, Ganesh, I am about impact. I really want to build a company which is going to have an impact, which is going to have really an impact for making sure the patients get the best of the care, less time, with the least cost. I think that's what is important, or no cost at times, because again, we have to serve all kinds of communities. So I think for me, Velmini is that channel, that means, which I want to reach to those kind of patients where I feel that they have, for example, have not felt the need because they did not know about it. But if we can, with proper education, proper encouragement, can help them take the health in their hand, right? I think that's the other thing that I feel that we all can do is have the patient be responsible for their own health, take their health in their hand, and I think they can do better job. Then you're right that pharmaceutical companies telling you, or doctors telling you, but if you know this can help me, you'll probably do it better.
At least they need to. At least they need to have a choice, right? I mean, it's not just
They need it.
being a cog in the wheel, and it's so. AI is a big deal, and I tell people it's folks don't always realize this, but humans are actually not very good in a lot of things, right? We make mistakes, we get tired, we misinterpret data, we get emotional, we have a bandwidth problem in the amount of information we can actually consume. So most decisions humans make are not really data driven decisions. Now, there's a strong gut feeling to it, but the big opportunity, if you pair the whole analytical side with an extension powered by AI for the human being, you automatically end up making better decisions, faster decisions, more impactful decisions with more of the data. So I think it's a big deal, and in fact, there could be no other nobler pursuit than to apply that into the healthcare industry, and like you're doing in dentistry initially and so forth. So Minnie, this has been fascinating. Where can the viewers and listeners get in touch with you? Where can they find you on the internet?
So they can actually reach out to my website, which is velmini.ai, or our free product, seconddentist.ai. They can ping me on LinkedIn. I am very active. I love to chat with people. I believe in networking. I am always open to hearing new ideas. As I said, I love to build really innovative solution. That's my passion. I love to talk to people who are thinking that way, and I love to talk to people who are really looking to make this world a better place. And Ganesh, you're one of them.
Oh,
You and I had always connected on various lens, and I said not just AI that brought us together; it's the way we think together. And I am so thankful that I was able to be in this show and in this podcast with you and share the dice and then talk to the world of what you and I think about AI and how AI can make that impact.
no, Minnie, thank you. I'm so grateful that you decided to come onto the show. Thank you so much for taking the time. It was a blast. Thank you.
It was my pleasure. Thank you. Thanks.